We move to the next procedures in orthopedics, which we'll be discussing this evening. So this is the Darrach and Sauvé-Kapandji procedures. So they usually go hand in hand, okay? So that's why even in discussion we always discuss the two of them together. Darrach or Sauvé-Kapandji procedures. So let's look at them. As a mode of introduction, we said that there are actually two surgical techniques. Now use them to treat what? Distal radioulnar joint fractures. Do you understand? Not only fractures, any issues, okay, at the distal radioulnar, okay, any issues at the distal radioulnar. It could be arthritis, it could be trauma. That's the fractures I was talking about. It could be instabilities. So of course they have what? A common goal. So all of them want to relieve the pain. They want to restore forearm rotation. Do you understand? But they differ in how you'll be able to what? Do them. So let's start with the Darrach. Can you see that there's a resected ulna in Darrach? The ulna is not joining here again. Okay, it's resected. So it's a surgical excision of the distal end of the ulna, so it will eliminate the pain. If there's impingement of nerves there, it will now put an end to the whole issue, the whole drama. Do you understand? So pros, what are the advantages? It's simple, it's quicker. Effective pain relief is good for the elderly or low demand patients. What are the disadvantages? There's risk of what? Ulnar stump instability, may cause weakness or clicking during forearm rotation. Okay, it's less ideal for younger people. Do you understand? So younger people, you are still active in your life, you want to still do many things in your life. Imagine they are cutting your ulna out. Okay, let's quickly look at the next one, which is a Sauvé-Kapandji. Now Sauvé-Kapandji, we said that it's fusion of the what? Distal radioulnar joint with creation of a pseudarthrosis, that's a gap in the ulnar shaft to allow rotation. See, you kind of like cut it, but you didn't cut it all. Alright, you still fuse it, okay, but this is a space, okay, to allow rotation. So goal is to preserve forearm rotation while stabilizing the distal radioulnar joint. Advantages: there's a better grip, lower risk of ulnar stump instability. There's higher rate of return to work, like it will help you much more preserve your working ethics. So cons: it's technically more complex, higher risk of non-union, right, and all of that. Okay, so that was it for the Darrach and Sauvé-Kapandji procedures, both used in treating issues of the distal radioulnar joints.